Welcome to episode 1 of Free My Pain Now with Dr. Matt DiDuro. Stay tuned. All right, well, good afternoon. And today I have with me on our first episode, my first patient, Miss Sherri Urbano DiDuro. She goes by Sherri.
Hi.
Thanks for coming today.
You're welcome. Glad to be here.
Yeah, I didn't really give you any notes or anything. I wanted you to be real and from your heart. But, you know, our podcast is going to be about empowerment. It's going to be about patients becoming their own advocates, right?
Right, exactly.
You can't just rely on what your doctor says or your lab results anymore. You have to become an expert in your own condition or diagnosis.
Absolutely.
And unfortunately, you've had a few in your lifetime.
Right.
And how we have dealt with that has been both trying in a couple different ways, you know, physically, emotionally. I like to think back, I am a chiropractor. And I remember when I started chiropractic college that, you know, I was so excited because chiropractic had helped me, and you're going to hear that in episode 2, my story. But today is really your story. And when I met Miss Sherri, she was a nice young lady in your mid-20s. And when I met her, she didn't have movement in her index or thumb on either side, remember?
Correct. Yeah, I had been going through some stuff with it started in my elbow and it went down to my hands. It was bilateral.
Mm-hmm.
And that's about the time I met you.
And I was just a chiropractic student at the time, and I think I was in my first quarter at Life University. And I was concerned. Well, first off, I liked you, and I wanted to see you healthy and able-bodied. But you had been at a concert downtown, right, in Atlanta?
Yeah.
And it was during the time when there was mosh pits, and you were sitting on the outside. Do you remember this?
Yes. Oh, yeah. I remember. I was there.
And somehow you're talking to your girlfriend, and you got hit from behind, almost like a whiplash. Your head went back.
Yeah.
And you woke up the next day, you had...
Oh, I had pain in my neck and a lot of pain going down my right arm.
And so you
And it progressively got worse.
Yeah, and you got to the point you couldn't even drive your stick shift.
Yeah.
You had to borrow your parents' car.
Yeah, and I saw like 3 different orthopedics. I saw 3 different neurologists, lots of testing done. Nobody could figure out what was wrong with me. And then their final suggestion was, well, let's just do some exploratory surgery. And that's really about the time I met you.
And
you were like, what?
And I had worked in my brother, Dr. Joe DiDuro, was a chiropractor for about 10 years prior to this. And so I had an understanding of way people make diagnosis and how you move forward. And I was pretty surprised that they hadn't even taken an x-ray of your cervical spine at that point. And anytime it becomes bilateral, meaning both your right and left side or right and left hands, I was thinking you've got to go back to the source, which is your cervical spine. So with Sherri's permission, I called her orthopedist at the time. And, you know, I said, hey, doc, and we're not going to say his name, but he still practices here in Atlanta. But I said, doc, I'm a friend of Sherri Urbano's, and I just want to kind of walk through and see what's happening here and just make sure we're covering all our bases. And I said, we're going through some stuff. And I said, doc, why haven't we taken a cervical x-ray at this time? I mean, it's in both hands. And he was like, oh, I don't know. I'll have to check her file. I'm not sure. And I said, I think that's the next step. We need to have that done. And then I asked if he would refer you to or write a referral for a chiropractor. Remember that?
Mm-hmm.
And he got really upset. This is 28 years ago, right?
Right.
Times are a little different with medical doctors and, you know, alternative physicians and providers. So I know it got to the point where he hung up on me. Remember?
Oh, yes, because, well, you're from New York, and you started like arguing with him.
You know, he said he wouldn't, and I'm like, wow, her insurance will pay for it, doc, if you, and I was just astonished that he wouldn't do that.
Yeah, he hung up on you, and then the next evening,
Oh,
I got a phone call. We
Next-
need to schedule you for a cervical x-ray.
Right. So at that point, we went, we brought you to life. We had some x-rays done at their outpatient clinic, which is my alma mater. And the x-rays were beautiful. And then we actually got you in with a chiropractor, Dr. Harvey Fish, who's one of your first chiropractors.
Yeah, he was my first chiropractor. He was one of my clients.
Yeah. You worked at
he's
Marietta
like,
Daily Journal.
You've got to come in 3 days a week.
Mm-hmm.
And
He took care of you.
after maybe about the 5th or 6th visit, I started getting movement in my fingers.
That's
I was
right.
so excited.
You got it on the right side first, and then the left side.
Yeah.
And it took about 6 or 8 weeks for your body
Probably,
to
yeah.
start healing. And I mean, you couldn't pick up pennies,
I couldn't
quarters.
button a button on my
Yeah.
shirt. I had to take pictures for my job. I couldn't click the little, back then, you had to push a button. I couldn't do that.
Right.
Yeah, I couldn't write.
So you got better, and you healed, and your body takes time to heal. That was the big thing. I mean, if you'd had that issue for 3 or 4 weeks, it takes your body another 3 or 4 weeks once you get that pressure off. And Dr. Harvey Fish, rest in peace, Doc. He had passed away a couple years ago, but always has a soft spot in our heart for what he gave us and you. So we went through that. You were lucky enough to not only start hanging out with me and dating, but she was also my boss. She got a job as a marketing director for Today's Chiropractic. So
That's right.
and then you dated your intern, who's me, then married. But so that was one of your first episodes, and what happened. And I mean, you were not the most healthiest person when I met you, I would guess.
Well, I had a terrible diet. I was in my young 20s. I was having fun.
You didn't have to work out.
Who had time to cook a nice meal?
Right. So, but you did, I think you used to like to drink soda or potato chips in the morning. It was something crazy like that.
When you're running late for work and
Okay.
then you have a vending machine to grab
I hope our
breakfast.
daughters don't hear this. So you were not eating wonderful. And as I was going through school and learning all about the body, I realized, hey, my cool girlfriend, she might be hypoglycemic. Remember that? Yeah.
Yeah, I remember.
So she would get hangry, which means if you're not eating within a certain amount of time, you'd get hungry and angry. And so we worked around that. You also smoked a little bit. You're a cigarette smoker. And I was also taking like radiology and seeing like after 20 years, these people developing, these terrible tumors and lung things. So I was like, listen, if it's possible, why don't you stop smoking? And I will say it was like New Year's Eve. I don't remember exactly, maybe 1991. She stopped that night and never picked up another cigarette.
Yeah,
So-
it was a very random thing. I'm like, yeah, I'm just going to quit tonight.
Mm-hmm. And I've always been impressed with your discipline, the way you're able to do that. And that's pretty cool. So, we got married, and then you've watched me go through my last couple years of chiropractic college. And then I became a chiropractic doctor. And we moved up to upstate New York or central New York, where my brother, Dr. Joe, was moving to Italy with his family, and we were going to take over his practice for a year. It was a wonderful opportunity. And while we were there, we were in New York for 12 years, had 3 wonderful daughters. And I think after your second pregnancy with Emma, you got gestational diabetes, right?
I was borderline with our first pregnancy.
Mhm.
And then, yes, with the second one, they wanted to put me on insulin. And I knew nothing about being a diabetic. I'm like, oh, can I just do a diet? And they're like, sure. So I did. And I did have her a little bit early, like a week early. But all this extra sugar in my system went straight to her. And she was a big baby. She
Emma
was a
was
9-pound baby.
9 pound, 8 ounces.
Yeah.
I
So
thought she was a middle linebacker when she came out. She had these beautiful shoulders. I'm like, oh, she's got a Division I scholarship.
But then when I got pregnant with my third child,
Analia.
I checked my blood sugar really early on because I had the glucometer, which was a good thing, and I just didn't trust the time frame for the docs that they did. And I can't remember back then at what point they would check you early if you had a history. So I checked probably 3 to 4 weeks even earlier. And bingo, my blood sugar was elevated. And I went on insulin shots with her and had a normal pregnancy.
You're lucky. 2 years after Annalie is born in 2002, you're diagnosed with?
Type 1 diabetes.
Type 1 diabetes, right. And even though it was an adult onset, because you were older, you were type 1 because it was considered you had to be insulin dependent.
Yeah, my body stopped making insulin. So I had to inject it.
Sorry to hear that. Stop making
it. Was hard.
Yeah.
It was hard to go through that.
And I'll never forget, I mean, because sometimes you don't understand when you're in the trenches and what is going on, but I pulled you aside. You were really bummed out for a couple of days, and I looked at you and I said, Sherri, a couple of weeks, but a couple of days you were down out. And I said, hey, in our practice, we saw so many sick people. And I said, Sherri, compared to the people I'm seeing and working with, this is nothing. You'll get through this. And we decided, we made some serious changes in our diet. And again, you're the most disciplined person that I know, because she would test her blood 6 to 8 times a day, and she'd have to do a pinprick and glucometer. And you really...
You have to.
Well, the thing that I was so impressed is you became a student of this, and you really consumed as much information as possible on it. And again, you're one of the most disciplined type 1 diabetics that I've ever seen. You test your blood all the time. You know what's happening. And it's important. We'll talk about diabetes and your blood sugar in an upcoming episode. But the one thing to know is when your blood sugar goes up, it will it thickens your blood. So the viscosity of your blood, instead of it being like water, when your blood glucose levels go up, it gets thicker. So it doesn't get through the smaller capillaries.
Yeah, it becomes more like a syrup or oil. It's just really thick.
And it can't get into those, cannot get into the small capillaries of your eyes, your fingertips, your toes. And I think that's
where all the damage happens.
That's important for our next episode. So, welcome back to Free My Pain Now with Dr. Matt DiDuro. And I'm episode 1. We're on the second part, and we're chatting with my lovely wife, Sherri DiDuro. So, Sherri, you've gone from Cheryl Urbano to Sherri Urbano DiDuro. We understand you have some, since you got married. But, okay, in the first segment, we really talked about healthy lifestyle, have a couple babies, you get type 1 diabetes. You're dealing with that, pretty wonderful. Within a couple years, 2004, I believe you actually got an insulin pump. And what was that like?
Oh, that was amazing.
Because why?
Well, when I started on insulin, I was doing injections. So I would mix 2 different insulins in the morning, inject. That would peak at a certain time. Had to eat. Had to eat at the
9
same
o'clock,
time
12 o'clock,
every
5
day,
o'clock.
and I had to eat a certain number of carbohydrates at that time. So, going out to dinner with friends was a challenge. Going on vacations was a challenge. A summer schedule is a challenge because you want to maybe sleep in a little, or everything was very time regimented. And actually, your cousin's child was a diabetic, and I had been
Judy Dijon. She helped us a lot.
Talking with her a lot, and she's like, "You got to get on the pump. You got to get on the pump." Well, I was only doing 2 injections a day. I didn't qualify for a pump, so she's like, "Well, there's this new thing that came out. It's a long-acting, non-peaking insulin, and it's called Lantus, and you should do that." So,
okay.
And this kind of goes back to where you have to be your own advocate, but I go to my endocrinologist and say, "Can I get on this insulin?"
And she's like, "Oh, you're a type 2 diabetic. You can't."
She said, "No.
Right.
Why would you want to do that? You're going to have to do 4 injections a day if you do that." And I just remember looking at her and thinking,
I need a new
do you really
endocrinologist.
think that doing an injection is the hard part about being a diabetic? Because I will do all the injections I need a day if I can have a normal lifestyle. And I can eat when I want, and I can go out, and I can have cake at a birthday party. Like, those are the big things that that I pushed for. I'm like, I'll do, and then I got up to 4 injections a day, and then I was able to get on the insulin pump.
And we had to fight not only your endocrinologist at the time, but we had to fight the insurance companies. And I always say the insulin pump that you got was a Medtronic, the first one. It was a game changer for you. It didn't cure your diabetes, but it gave you a tool to manage this chronic condition. So we enjoyed it. It was good. We moved down here in 2007. Specifically, one of the reasons why we wanted to come down here was an unbelievable endocrinologist, Dr. Bruce Bodie, who you've worked with for over 12 and a half years now. Yep. And he's been instrumental in not only helping educate you, but also keep you as healthy as possible and really know your A1C, which is your 3-month average of your blood glucose levels. Yep. And we've been reading a great book right now, Dr. Bernstein. What's the title of that? Understanding Diabetes. But he's an amazing guy. He's the oldest living type 1 diabetic. He's about 83 years old. And he's just amazing. And his story is so cool because, and we're hopefully going to have him on the show if he travels. But one of the cool things he talked about was what that perfect blood glucose number is 83. And how hard it is, for a diabetic to get to that, because most of your medical doctors want to keep you between 100 and 120 so that you don't have those lows that can kick you into ketosis. Right. So fast forward, you're doing pretty well. In 2014, October 1st, I'll never forget the date, you were diagnosed with stage 3 breast cancer. And you had gone in for almost 10 years, gone in for mammograms. And, one of the things that we want our listeners to understand is that really after age 40, females have dense breast tissue. So, yeah, they get dense breast tissue. And the mammograms are not always the optimal diagnostic tool. But the fact that...
No, because cancer will hide in dense breast tissue.
So our listeners out there that are over 40 that are females, you want to ask for the diagnostic ultrasound, correct?
Well, the first thing you want to do is confirm if you have dense breast tissue, because I evidently had it for a while and I had no idea. It's not something that you feel. It's more of something with the imaging. But I never knew that. And had I known that, I should have been having the diagnostic part of that mammogram. And literally the day that I went and had a mammogram, and then I had the ultrasound, and then the tech said, okay, let me go show the images to the radiologist. She came back, and he's like, he wants to talk to you. Came in. Which is
never a good sign.
He goes, when I looked at your mammogram, I would have sent you home that day. Like, everything looked great. Send you home. But when I look at the ultrasound, I see a totally different image, and I'm highly suspicious. So once again, they would have sent me home. And
you got to ask the right questions.
I might not be here today because it would have just continued to hide for just having a mammogram.
It was a stage 3, stage 3 breast cancer in your left breast. For the first 2 days after that diagnosis, I know there were some tough days. We cried and cried. I mean, you just feel so bad. And there's so many emotions that come with that diagnosis. And, our heart goes out to anyone out there who's suffering from this, or any family members. But the thing I remember is I got a call from one of my buddies, Dr. Steve Barnett, who's at DeKalb Medical. And he said, Matt, if it was my daughter or my wife, I would take her to Cancer Treatment Centers of America. Because we were trying to get in for this appointment, and it was going to be 3 weeks for this breast MRI. And
you have to put together your team, and it's at least 4 or 5 people, and
coordinating all these different doctor schedules. It was ridiculous. Steve got us down, made a couple calls. We got into Cancer Treatment Centers of America down in Noonan, Georgia. And we pulled up there, and it was like the Ritz-Carlton of hospitals. They have valets, and we stayed right there. And, the definitive diagnosis for breast cancer is actually an MRI. they did a breast MRI. And I remember asking the tech, I said, why isn't this something that we do? And why don't we use these MRIs for breast as a screening tool? And she said, it's just too expensive. Insurance companies wouldn't pay for it. And I thought, how crazy that we allow an insurance company to dictate the optimum health for someone or the optimal care. And I'm like, what is my wife worth? What is my daughter worth? What is my mom worth? So, I mean, one of the things we're going to talk about is how do we empower our listeners to actually ask the right questions, find the right doctors. You know that list of the doctors that are out there, and you want to be on that. You want to work with those top doctors. And we may not know everything, but we know that those top doctors in Atlanta, and that's the great network we've developed the last 13 years we've been here. So you go through 4 months of chemotherapy to shrink the tumor. And after her second chemo treatment, she developed chemo-induced peripheral neuropathy so bad in her hands and feet that she couldn't button a shirt anymore. You couldn't hold a toothbrush, metal forks. You were very sensitive. And it made it tough. Your feet blew up like little watermelons. And I remember when Dr. Tran, your oncologist, saw it, she kind of pulled me outside and said, hey, we're either going to have to stop her chemo or decrease it by half its strength because she just can't handle it. And I was really still focused on the treatment that they had set up in the care plan, that you had an 87% survival if we did, you know, the things they put together. And I said to her, I said, Doc, what does that mean for her survival rate? And she goes, well, we'll have to cross that bridge when we get to it. And I said, oh no, wait a second. Doc, I don't know if you know what I do. I am a chiropractor, but I work with Neuropathy Treatment Centers of America. And I asked her if we could use these polychromatic low-level lasers that we treated patients who had diabetic neuropathy or chemo-induced peripheral neuropathy, but they had, you know, already been through their chemo treatment. So we got approval. She said, as long as you wait 24 hours after your chemo's done, and you were getting chemo every 2 weeks. So we started using these polychromatic lights, and they're a big part of what we do at our clinic here in Atlanta. And we'd use those lights on you in the morning, both your hands and feet, for 20 minutes. We'd move them. We only had 2 pads. And then 8 hours later in the evening before she went to bed, we'd do it again. And we did that for 3 months. And I'm knocking on wood and giving you a kiss, but she was able to do all the chemo and really stay on track with that care plan. Right. So we actually did a documentary about this. It's a pretty cool story. We'll be launching that at the end of July. So we're at mid-June right now. But, you know, I can have our listeners, we can have a link set up to it as well so they can see the early edition of it. But it's a great story how we have worked with dozens and dozens of chemo-induced patients at our clinic. And you were really the reason why we did it. I mean, out of necessity, right? You have to invent certain things to make sure that, you know, you keep your family healthy. And that's the thing that I want to tell our listeners. We've already done this. You know, we've been out there. We've gone to doctor after doctor after doctor. And everyone has trials and tribulations in their life. And how do you address them, right? And I remember when we were in the tightest thing, one of my patients said to me, you know, God only tests true men. And I remember that. And I've always lived with it, that, hey, there's certain things that we're going to have to deal with in life. And, you know, the fact that we did it together in a couple, there's nothing that I can't, you know, face with you. So, all right. So that's our segment 2. 4 years later, she is still healthy and virtually cancer-free and very lucky.
Going with that.
Yeah. And we'll talk about different things and how she became really an expert on her condition.